the longest that I was able to stay free of sugar was 2 years. And then it was my partner bringing it in, there we are in bed and the chips are out and I'm going, I smell it and I see that, oh, it's okay because there it is. And even though I knew it wasn't a good idea, but now my rule is no food at bedtime in the bedroom. And because I'm weakest then, and I have this bubble of support that I walk around with me. And like this podcast is an example. Somebody listening to that, I would suggest that somebody listen to a podcast like this every day instead of praying. Like this is their prayer for the day. Prayer is, it's a bubble of positive hope that you carry with you.
I'm delighted to introduce my special guest for today, Dr. Vera Tarman. Dr. Vera Tarman is the medical director of one of Canada's largest treatment centers for substance abuse. She is a world-renowned food addiction expert who writes, speaks, and treats people who suffer from food, sugar, and flour addiction. She is the author of Food Junkies, Recovery from Food Addiction, which is now in its second edition. She is also co-host of the successful Food Junkies podcast. You can also find her at her free Facebook group, I'm Sweet Enough, Sugar-Free for Life, and her YouTube channel, Vera Tarman, MD. Without further ado, here's Vera Tarman. I'm so delighted to have here today with me my special guest, Vera Tarman. It is such a pleasure to have you. Thank you so much.
Well, thank you for asking me to speak.
Of course. You do really important work in the fields of food addiction. And because you're such a specialist in food addiction specifically, I would love to drill into those type of questions. And for people who are coming to my podcast, because it's called Beyond Binge Eating, and they resonate more with the words binge eating and are maybe not as familiar with food addiction, can you just describe what food addiction is?
Sure. And it's useful, with a concept like beyond binge eating. Food addiction and binge eating look so much the same, and in fact, may in some ways be seen as the same thing. But we can talk about the differences as we go on.
Yeah.
But the essential definition of food addiction is it's basically the compulsive use of eating or food despite negative consequences. So there's a sense of compulsiveness and inability to control, and there's that sense of even when you know better, you can't stop. So you have those kind of two pieces together. And you'll see that with binge eating as well. And it makes it a very muddy concept. But where we're coming from with the food addiction world is that this is behavior that is replicated with any drug. So the way that people use food is the same way that they use cigarettes, the same way that they use alcohol, even cocaine or other drugs. And once we look at it with that view, those eyes, we have a whole set of concepts and tools in recovery that we can bring to the area of disordered eating.
Absolutely. Thank you. What do you think about, calling it eating addiction or a sugar addiction, food addiction? What do you think about it being a substance addiction versus a process addiction? Do you have any thoughts about that?
That is a really good question. It's disordered eating with an addictive dynamic. And so food addiction is the term that I've used forever. Just as if I were to smoke a cigarette or put a drug into my mouth, it creates a reaction which, it's this dynamic of addiction with food. So that suggests that it's a substance. But I actually like the larger umbrella term of food addiction because I also see people behaving using the process of eating as an addiction too. And that's not usually the early stage of food addiction, but later on, you'll see people even restricting. That's a behavior, becomes an addictive process. That's part of food addiction. And so is overeating, binge eating, or compulsive grazing. That is not even of healthy foods, like too many carrots and too many celery sticks. But if it's that need to continually eat and be full, that's a process. But I think it's also part of the term of food addiction. So the official answer right now would be that we're seeing it as a substance. But I hope and I think that in the long term, as the condition becomes more acceptable, we will also embrace the idea that it is a process as well, because I think it is.
Absolutely. Yeah, I'm sure you've seen many patients who come to you and say, man, I'm overeating like pounds of vegetables, or, they eat so much beef jerky, or they're eating just so much, even if it's not, they've cut out the ultra processed food, but they still continue the behaviors that they're feeling unhappy about.
Yeah, and you nailed it right on there. They're still feeling unhappy about it. So there's still that sense of compulsive eating despite negative consequences, which is what addiction is. It's really just
Mm-hmm.
what spurs off the trigger, the dynamic, and that can be eating itself as well as the substance.
So how does that relate to a volume addiction? Is if someone is eating just a ton of food, even if, and they're feeling, they don't want to, it feels very compulsive. There's a lot of negative consequences, and yet they still feel like that they are unable to control behavior. Would you call that a volume addiction?
Yeah, I like to use the word volume addiction, but is there scientific proof? I think at this stage, volume addiction is a useful term because people can kind of get that. You need to get that
Mm-hmm.
sense of being full, and even if you're full, you still somehow want to feel more full, which is the volume. But I think it's actually a composite of a number of mechanisms. It's got to do with the stretch receptors. It's got to do with a mental sense of security. It's not just one thing. So it's certainly not a substance. That's actually more of a behavioral piece. And that's actually probably where it gets confused with binge eating. Like, I really think that we continually in the food addiction world and in the eating disorder world see them as separate silos. I think we're going to do a lot more help for each other to try to find the common ground, like you're doing here, speaking with me.
Mm-hmm.
Like, I think there's much more
Mm-hmm.
similarity, and in that similarity, some actual common mechanisms. And actually, volume
Mm-hmm.
is probably one of those common grounds.
Absolutely.
Yeah.
When you work with a patient, or do you call them patients or clients?
Well, it depends. In my medical, they're patients, but I guess in the general world of food addictions, clients.
Okay. When you're working with someone that comes to you that is asking for assistance in overcoming their problems with compulsive eating, binge eating, food addiction, where do you start with them?
I'd have to do an intake and assessment and determine, first of all, do they have a food addiction? Is it just comfort eating, using food for comfort or for distress tolerance? In that case, should we be, that's more of almost like an eating disorder model, or I don't know, should we work with the psychological issues and not focus too much on food? Because if you focus too much on food, you're kind of missing the boat of if there's something else going on. I think that assessment becomes really important. Both, what are we actually
Mm-hmm.
looking at? Is it food addiction? Is it actually when I put something into my mouth, regardless of my mental state, I want to have more? That's more food addiction. Versus, is it a psychological or even just a normal thing? I'm eating, people who are eating foods that are highly palatable, engineered to be addictive, are going to be eating addictively. And so if they're not eating the chips and the ice cream and all the stuff that the food industry makes us overeat on, then if they stop eating that, maybe they'll be better. So I don't want to assume food addiction until I have a proper assessment. And then, because I have an interest in the sort of progression of food addiction, like I wrote an article on the
Mm-hmm.
5 stages of food addiction, I'd want to know, what stage is the person at? Are they at an early stage, so that maybe we don't have to be as restrictive, because it's going to be seen as I'm depriving the person, and it's they're restricting and throwing rules, and oh my God, this is crazy. Well, I don't want to impose that kind of regime on somebody who doesn't need it. So I want to determine where the stage is. So it's going to be probably 2 or 3 sessions of getting the story of the person and where do they think the problem is. A lot of it will be with their previous history. Like, some people have, since day one, since when they were 4 years old, they remembered eating compulsively more than other kids did. Well, that is a sign that there's something going on there. But others, it's just been since they tried to lose weight. Like, get the story behind it. And it's all about diagnosis, or yeah, what am I working with in terms of the, I don't want to say pathology, but the disorder.
Mm-hmm.
And then how extreme do I have to be? Because I don't want to go too far, but I also want to go far enough. So that would be the first thing that I would do. And then after that, I'd want to know what they're willing to do. And that's really important in terms of the treatment, because a lot of people will say, are you kidding? I'm not going to do that. Well, then, okay. If they're not willing to think ahead about their food, whatever the treatment regime is, if they're not willing to do that, then It's what we say. You don't want to work harder than the client, but the client has to have the buy-in, and they have to believe that this is going to work. So maybe that's the next step, is helping them understand where they are and why it is that the treatment protocol that you're suggesting may actually be helpful.
How often do you see with your patients or your clients if they've been struggling for a really long time, whether that's 10 years, 20, 30, 40, 50 years, but let's say it's at least 10 years that they're struggling? Do you find that it is possible with the population that you work with that they end up on a moderation based nutrition plan? Or do you see that if they're 10 years plus, that most of the time that they do better with an abstinence based nutrition plan?
It's a sneaky question, because we all want moderation. We all want to be able to just have a little bit. But usually by the time a person comes to see me or somebody in a coach, where they have to actually pay for it or make the effort to go and
Mm-hmm.
do it, they've done multiple moderation attempts. If they haven't, absolutely try a moderation attempt, because again, I don't want to
Mm-hmm.
throw abstinence, which is going to feel like deprivation and agony initially. I don't want to do that. But most of the time, like you said, 10, 15, and we see people with 50 years of experience, and they've tried abstinence on many levels. Most of the diets out there are pardon me, moderation, are abstinence
Yeah,
for 2 or 3 weeks or months, and then it's moderation, and that's where they fail. So that's where getting the history is helpful, because you'll see that they've already tried the moderation approach, and usually know intuitively it's not going to work.
absolutely. I support that approach so much. I think that just one of the biggest challenges is that our society is just so in an era of so much indulgence, and just it's very much like you only live once.
Yeah,
We really have to, stay out late. We have to, drink and indulge our senses, enjoy every little thing. And I think that that really puts a lot of shame and judgment on the person who's embracing a whole different
well,
lifestyle.
let me rephrase that, because I think that you could have the best of both worlds of what you said. Because I think, and I'm sure you're going to agree with me here, if you're eating good, healthy food, then we have no problem with you enjoying to the nth degree the food that you're eating. The idea of we only live once, let's enjoy our food. Absolutely, let's enjoy our food, but let's enjoy the food that our bodies were programmed to eat. The stuff that we're talking about is not food; it's drug food, and we were not built for that.
Hmm.
And to enjoy that, I mean, that's like saying, we're meant to enjoy life, so go out and jump out of a plane without a parachute because it's going to be fun. It'll be a lot more fun if you have a parachute and make it to the bottom. So, like, let's reframe that argument by saying you're not going to be deprived of foods that your body was built for. You're going to be deprived of the damaging foods that they're not telling us are damaging.
I'm 100% in agreement. I'm living that proud grandma life. I like to go to bed early. I like to wake up early, and I don't drink. I don't do drugs. Like, I, like to eat a lot of steak. I stay away from, sugar and stuff like that. And I find that that is what makes me feel good. I went to a party last weekend, and I literally left at like 9ish because I was tired and I felt good. I stayed there for like an hour or so, maybe two, but I knew that that's what it was going to be when I got there. Like, I'm just going to go and enjoy for the time that I'm there, and when I'm done, when I feel tired, I'm going to honor my body and come home, and then the next day I'm not destroyed. And you only live once. It's like, okay, I partied plenty
Yeah,
in my 20s and 30s, and now you only live once means to me taking great care of myself,
yeah,
because, if I'm going to be drinking all night, I'm going to be destroyed, and I'm going to meet an early death. So it's like, for me, you only live once is like, take great care of yourself by honoring your boundaries and doing what you got to do, even if that's different than what the rest of society does.
yeah. Well, what's interesting is when you get older. I'm in my 60s, and you only live once. But in my 60s, I'm living the life. Like, I don't have a cane. I get to walk and to take my dog out,
Hmm.
and I'm not disabled like so many of my peers are. With the diabetes and the canes and the this and that. And I go, oh my god, I'm living the life.
Absolutely. I've noticed in stalking your Facebook group and in your YouTube videos that you have a discussion point regarding being sugar free versus sweetener free. And I think that that's a really interesting nuance that can, I guess, really make or break some people who are sensitive to that. And I'm wondering if you can elaborate on what your perspective is on that.
It goes back to that idea about what is food addiction actually. So in the case of sweetener, it's not the insulin spike, it's not the sugar, it's response, because it's not a sugar, but it's a sugar substitute, and it fools the brain into thinking that it is sugar. And if we utilize the idea of addiction, remember I was saying that if you take the concept of addiction, all sorts of extra concepts and tools become available to use. And one of them is triggers. And if I have a sweetener, my brain is triggered into thinking that I'm going to have sweet, and now I want sweet. We know that in the general, like it's shown research-wise outside of the addiction field, that sweeteners don't help people lose weight because their brain is thinking sweet is coming, so they're going to eat more because they're not actually getting the promise, and so that they're actually eating more. It's part of that idea of you're setting the brain up to want something, and that would be like the alcoholic who goes and has a near beer or a mocktail. Like a mocktail, sure, but if it's too similar to the substance, the person is thinking about the fact that they're not having the like it introduces a sense of deprivation. It's much easier to just not have it there at all, and that's why some people can tolerate sweetener. And I actually think sweetener is a useful temporary measure, like a bridge when you're quitting sugar, because it frightens people. Oh my God, how will I never have sweetener again? If they have the sweetener, they'll quit the sugar. But then we would say eventually, if you want to have freedom from excessive thought about food, eventually get rid of the sweet, just because. And some people have to get rid of it sooner than others. Like for me, it took a few years. And quite honestly, occasionally I'll slip back and I'll have a sweetener a little bit, not much. And then I'm always attentive, like, why am I doing that? That's interesting. I don't worry too much about it. I would if it became a big thing. Like it's one of those gray area. You said nuance. It's a nuanced gray area to pay attention to. I think it's actually a mark of how advanced the food addiction is that a person can't have it at all. But there you go.
Yeah, no, I think it's really important because some people I think would really, really be their recovery could really stall if they're
Yes.
having 10
Oh my
sweeteners,
God.
thinking that it's okay, and really
Yeah, I remember.
it's
I
not.
remember in my early days, I would make muffins or something, which is another thing. Like even foods that are if they look too much like the real thing, it's not good. But anyway, I would pour like tons of sweetener in it, and it's not satisfying. You just want the real thing then. Yeah,
Mm-hmm.
that's why in the
Yeah.
Facebook group we ask people to not have, especially of the dessert type of things like the replacements, to not have pictures
Mm-hmm.
that are so triggering because the brain sees it
Mm-hmm.
and immediately thinks, "Oh yeah, it's not really a cheesecake, but it looks like one, and now the cheesecake is on my mind, and it's like the elephant that won't once you try not to think about it, you think about it."
Yeah, I kind of try to stay away from sweet-like things
Yeah,
because, yeah, I honestly try to keep everything pretty bland and just simple. Like, I just like simple, bland. It's called bland, but I mean, like, I'm not like a foodie, so I don't need
but you like it, right?
super. Oh, yeah, I like it. I mean,
Not that you're
what's
going,
wrong
"Oh,
with,
this is fuel." You're still enjoying it.
yeah, I mean, steak is amazing at any time. Ground beef and eggs is amazing at any time. Like, food is delicious and great,
Yeah,
so
yeah.
I love it. Another interesting point of contention is about the use of intermittent fasting. So some people who've had eating disorder or, problems with addictive eating have said that intermittent fasting has really helped them because it provides, an area of time where they're not obsessing about food, they have some freedom. But then there's other people who would say that that is damaging and risky for people who have a history with eating disorders or disordered eating. I'm just curious what your stance is.
I'm in the category of it's risky. And I think that if a person says, first of all, intermittent fasting, I do agree that a person should have at least two. I like the idea of three, but I could go with 2 meals a day and fasting in between. Like I do think that we need to
Mm-hmm.
fast in between. This eating constantly, no. But the idea of intermittent fasting, where a person is fasting for 12 to 14 hours and more, is, I think, a little bit risky early on. And I'm not saying you shouldn't do it, but I'm saying be very cautious because it has definite benefits. There's no question that it has benefits, but it also has a sharp edge to it. And if you're in early recovery, you might get stung by it. And if a person says, well, I don't think about food when I'm not eating, well, if you're not eating enticing foods, overly enticing, if you're eating, what did you call your food? Bland foods. You're not obsessing about it because it's bland. You're not obsessing about it. So it might be a sign that the foods that you are eating are a little bit too palatable, so that you're thinking
Mhm.
about it between your meals. Because the goal is to not think about it between your meals and not be hungry. So it would just make me question that if that's your tool. And then the other one that people, you didn't say it, but I know it's true. A lot of people are using it for weight loss. And you
Mm.
don't need to do that for weight loss if you're eating the right foods. Now, the reason why I'm cautious about it is because so many of us, like the ones with 50 years of back and forth dieting, have restricted. And if it puts you into a restricted mode, like you're hungry and you're cutting your calories, that is danger for a binge. Like it's the idea of you restrict and then you binge. And if it's going to put you into that thing, then don't do it. Like, because you don't need to. If you don't need to, don't. I usually say if you're going to be restrictive or intermittent fasting, do it with a coach who will do it with you, because it's going to potentially uproot some of your addictive tendencies, and you don't want to be on your own. I think it should be a medical tool with a not just an intermittent coach who doesn't know anything about food addiction, somebody who knows about food addiction and does it with you. That's, I think, when it would be done. Or wait a year or two into recovery and then assess, do I need to? And if I do, here's how I'll do it. Because you don't want to be hungry. The other thing about intermittent fasting is people will say, well, I won't be hungry because I'm fat adapted. But the person who's in new recovery is not fat adapted. They've just come off of a carbohydrate binge and they're going to crash and starve and be in a hypoglycemic mode, which leads to
Mhm.
a binge. You also don't want to do intermittent fasting until you're on a appropriate low carb, maybe carnivore diet where you can actually
Mhm.
sustain yourself for hours without
Mhm.
eating and not thinking about it.
Mhm. How does someone know what they need? I mean, that's a hard thing. I know you were talking about, you do a thorough assessment, but like, how does someone even know, like, oh, I need to see someone who specializes in food addiction? How would someone know who to see? Like, if someone needs to join, see a registered dietitian to help them, learn how to eat with moderation, rather than to join a food addiction program and be supported by people who can support their abstinence. How the waters are so muddy right now, as you said, as far as binge eating and food addiction. But is there a way for people to know what are they dealing with and what would be a better solution for
Well,
them?
I think a lot of people intuitively already know, but those, I don't forget, I see the people who have had 10, 20, 30 years and they've done everything already. If you've not done anything, then sure, go and see your GP, your general practitioner, or a dietitian and see if that plan, which is usually restricting in moderation foods. And if that works, good, because then there's not extra work and you've got all the support in the world, because there's a ton of people out there doing that. But if you've already gone that route, I think you're going to have to start looking in the food addiction world for support. And that's very hard because food addiction is not yet acknowledged. So, not a lot of people, even doctors, they're like really against this. Uh,
Mhm.
Now you're going to get caught into the whole world of the medications like the Ozempics and stuff. Like now, because
Mhm.
they've just come out, that's what physicians want to do. And so, in a way, we've got that hurdle that we have to get through, because I don't think those drugs are always necessary, or even most of the time. Sometimes they are, but
Mhm.
it's
Mhm.
unfortunate that their first line. First line should be what we're talking: food addiction. First line should be go to your GP, your dietitian, try out the moderation route, then try out the food addiction route, then maybe in conjunction, then do the medication route, which is the bariatrics clinicians, the people that deal with obesity. They work with that. So it's hard. I actually think for somebody, the best is to go like on my Facebook group or listen to podcasts like this to start to learn all the nuances and then find out where the resources are. There's also the whole 12-step world, which is, again, how does somebody know how to navigate that? There's like 10 to 12 to 15 food addiction groups in the 12-step. So it's actually better if you hook in with somebody who knows that scene and can help you navigate it. And that would be asking people like us, where should we go? Like I can tell you that from, if you're asking me, go on my Facebook group. I have a PDF of groups and therapists, coaches, nutritionists that are food addiction friendly. Not necessarily only food addiction, but they're very knowledgeable about food addiction, which is what you want to do. So there are resources. They're starting now. Interestingly, I mean, I've been around for a while, and my book, Food Junkies, you should read my book, Food Junkies, Recovery from Food Addiction. The first edition came out in 2014. There was virtually no treatment then, or very little. I should say no. We had a little bit. But now in the last 5 years, more and more people are interested and there's much more treatment in the last 5 years, and there'll be even more coming up. More and more people like you are interested in this and are getting knowledgeable about the training and tools. Yeah.
Wonderful. We'll definitely link all the resources that you mentioned in the show notes, your YouTube channel and your book, your podcast, and your Facebook group, so people could check that all out and also get that PDF that you mentioned in case they're interested in getting the list of those resources. One thing that I have curiosity about is that I've noticed in the food addiction world is that there is, well, this is kind of speaking to what you had mentioned earlier, is kind of like there'd be a benefit if there was a little bit more crosstalk and cross-pollination between the eating disorder world, specifically like binge eating and these binge-based behaviors, and the food addiction world, because it's really possible that someone who has binge eating also has food addiction and vice versa. And there could be some things that they could benefit from, whereas the binge eating sort of paradigm has maybe perhaps an overemphasis on emotions and maybe not enough on the food. I feel like the food addiction world maybe has, I know that you talk a lot about abstinence being one of the main keys to recovery. Is that correct?
Well, yes. Again, it depends on what we're recovering from. I'm working with usually end stage food addiction, or my concept of talking about food addiction is usually speaking to that population. Maybe another way of rephrasing that is define your abstinence. What does abstinence mean to you? And if abstinence means to you, I'm just not going to eat overt sugar, like added sugar, but I'm still going to have, I don't know, lots of cherries and honey and stuff like that. If that works for you because you haven't developed anything further, that's your version of abstinence. Generally, with me, when I define abstinence, it's no sugar, no refined carbohydrates. And then, like I said, ultra processed foods, which again are foods that are engineered to be addictive. So, yeah, you have to define your abstinence. But I think that if you've reached a particular point in the continuum of food addiction, abstinence is crucial.
So, how can a person maintain or be firm with their abstinence in a environment that was really counter to abstinence?
I knew you were going to ask.
And that is like, yeah, I mean, peer pressure is everywhere, and it's always like, oh, what's that Tupperware? Or, someone's like, why are you so picky? Or something like that. Or family members like, why don't you just eat this or something? How can someone be resolute in their abstinence with so many challenges?
Yeah, there's going to have to be a lot of reframing of saying, I don't want to eat drug foods. I don't want to eat foods that are going to cause me diabetes. I'm sorry. Like, you just call it what it is. And then it doesn't sound so much like you're restrictive, but actually using rational common sense. But of course, you're also dealing with your own triggers. Like when you see that food, it's like, oh yeah, maybe they're right. Like, second guessing yourself. How do you do it? It's having a clear sense of the reframing. What is your food? What's not? Like, people will actually have little tricks like, not my food. I don't eat that. Depending on the level of addiction, they may have to have particular behaviors, like they weigh and they measure their foods, or they bring foods in so that they don't have to ask questions of the pharmacy, of the restaurant. So how do they do that? So it's reframing what you're actually doing. And then the other thing is learning to set boundaries, because you said it, society is not respectful of this. We have to, outside of how we deal with it individually, we have to, almost as a political force, start reframing this battle to say it took us 40 years before we could say that cigarettes were so unhealthy and secondhand smoke that we sent people out, outside of the restaurant to smoke. It took that long. It might take that long for us to do the same with the dessert. Have the dessert in a separate room. If you're going to go have secondhand, that's going to take a long time, but we need to have something on that level. And when we talk about taxing foods or having pictures on it, like if you eat this, showing a diabetic foot, Snickers
Mm.
bar, just like you see the diseased lung on the cigarette package. It's that kind of stuff. But until then, it's going to be us taking care of ourselves, which leads to the next
Mhm.
super important thing, which we haven't talked about yet, which is support.
Yes.
We are porous social creatures. Even me, I'm very determined about something. But if I go into an environment that is all about the eating and the drinking and even smoking cigarettes, which I used to be a smoker years ago, if I'm there long enough, I can't help but I'm porous. Like we're social creatures. I'm going to start having some part of me going, oh, maybe. So I need to have a protective bubble, social bubble in this larger social bubble of people that want me to eat. And how do I do that? That would be by having a regular support system, like my Facebook group. I'm on there every day, an hour at least, maybe more, sometimes less, that will remind me that I have a social bubble that I carry with me to help me
Mhm.
against this. Because if I were doing this on my own, as I have in the past, I wouldn't stay sober for that long. I think the longest that I was able to stay free of sugar was 2 years. And then it was my partner bringing it in. There we are in bed, and the chips are out, and I'm going, I smell it, and I see that, oh, it's okay because there it is. And
Mhm.
even though I knew it wasn't a good idea. But now my rule is no food at bedtime in the bedroom, and because I'm weakest then, and I have this bubble of support that I walk around with me. And like this podcast is an example. Somebody listening to that, like I would suggest that somebody listen to a podcast like this every day instead of praying. Like this is their prayer for the day. That's what prayer is.
Oh.
It's a bubble of positive hope that you carry with you.
I love that. I think that's so important. And I 100% agree that when there's so many challenges against us to not maintain our abstinence, but if we can if there's a group of people around us that helps us to normalize it and that helps us to support that as a goal and lets us know that this is a worthy and important, valuable goal that supports our recovery, then that can make all the difference.
Those supports exist now. Like on my Facebook group, the group itself, there's the free groups there. There's 12-step groups all over the place. You can just go to AA and just say I'm an addict. Like AA, you just don't elaborate on what you are. The rules and the tools are all the same, and they're all as good. Like there is a lot of support out there once you learn how to make it work for you.
My last question, Vera, is what is, in your perspective, the relationship between abstinence and recovery? So if someone has achieved abstinence, does that mean that they are recovered or they're in recovery? What do you consider as in recovery, and how does abstinence play a role?
Abstinence is only the first step. It's only the first step. And if it's only abstinence, it's white knuckling it. It's like at some point I'm going to feel deprived. It has to be. When we talk about a spiritual awakening, so in a sense, first we were talking about a social change. You have to build a
Hmm.
social bubble to walk into that world. So you have to do a social change. You have to do a psychological change, like the therapy, the looking at the emotional nuances that you were talking about. You have to do that. And then the spiritual bit is this was our friend, this was our food, what is, I still love food, like I still love it. It's maternal. It's like, it's the first thing that I did when I was born was had breast milk being held by my mother. I'm assuming that's what happened. It's a very powerful connection. And if I abstain from the excess of that, like I just put it back to where it should be, food is being pleasurable, but not all my life, I have to replace it with something else. Because I do think we are all spiritual beings, which is just the quest for meaning, the quest for something other than myself. It doesn't have to be God, just meaning, a higher meaning. And if I don't find that, I'm going to keep going back to myself and my needs like food and whatever else. I think that it's really important that abstinence be the first step, but then You have cleared the road so that now you can do what your job is, which is to live life with meaning. And that's going to mean some sort of spiritual quest, like the quest being, what is my sense of meaning? What should I do? That's going to be different for everybody, but we got to ask that question. And I see this in all addiction. When I ask a person, what would you like to see happen with your life, and they don't know what to do, feels almost like it's an inevitability that they'll relapse. Like it's the person who says, I know what I
Mm,
want. I have hope. It's my family. It's my job. It's my vision of this. Then I think, yeah, they've got it. Abstinence clears the way for who you really are.
mm. Ugh, that brings my heart so much joy. I'm on the same page that it's like when you can stop living stuck in this in I just call it a shitstorm of
Uh,
just compulsive eating,
yeah,
then you can free yourself up to the space of living the life that you choose,
yeah,
whatever it is. Yeah, but it, if you're stuck in hell, you can't do anything.
exactly. And all that energy in the hell that you're in could be used to good. Like imagine that. You're going to fill all that
Mhm.
energy up, and then you're going to have all this energy to do good stuff instead.
Such great messages. Vera, can you please share with people who are interested, and I'll include this all again in the show notes. Can you share places where people can reach you if they want to follow you, get in touch?
First of all, please, my book, Food Junkies Recovery from Food Addictions, second edition. It's Audible, it's Kindle, it's every version that you want. Then I have a free Facebook group that's called I'm Sweet Enough, Sugar Free for Life. That is where you can go on as a new person or as a seasoned person and ask, what do I do? I'm starting off. And then you'll have people answer and whatnot. And also on there, I've tried to make it a clearinghouse of resources so that if you want a free group, you can like I said, I have this PDF. I have a thing that's called Therapy Thursdays, where people can say, "Hey, I'm a therapist, and this is what I do." So on Thursdays, go and see who's telling about their services. We have lots of free summits and all sorts of things. When there's podcasts like this, if I get the link, I'll post it. So it's all sorts of resources on food addictions. So that's the Facebook group. I have a YouTube channel that has all sorts of talks on like intermittent fasting and volume addiction and just the biology of food addiction. Oh, yes, the Food Junkies podcast, which myself, Clarissa Kennedy, and Molly Painshaw, it's kind of like the food addiction book live, like continuing the debates live, asking researchers and clinicians various questions. Like we just did one today on cheese addiction. Is cheese addictive?
Wow. I'm going to have to check that out. That is so amazing that you have all these resources. I just appreciate all that work so much. It is so valuable for me and millions of people.
If I can just say to you, it's so gratifying for me to see people having picked up this message and carrying it forward. Like there you are doing this, you're going to do your PhD, and on my senses, you're going to have some flavor of food addiction in there, so that
Yeah.
somebody's going to learn that in the eating disorder silo. You've got this
Mhm.
podcast, so more people who don't know me are going to hear it. Like you're carrying the message forward. This is very gratifying. I mean, I thank you for doing this.
Thank you so much. It was such a pleasure.
Okay, well, thank you.